Hi everyone, welcome to my YouTube channel. We'll be discussing about various interesting topics that are usually appearing in the USMLE Step 2 CK and 3 exams. Today we'll be discussing about cancer screening. So let's move on. We'll be discussing about lung, colon, breast and cervical cancer screening. These are the cancers that are usually tested in USMLE Step 2 CK and 3 exams. So coming to lung cancers, the candidates will be persons aged 50 to 80 years of age who have history of more than 20 pack year of cigarette smoking and are currently smoking or have left smoking within the last 15 years. The screening is done via low dose CT scan of chest and it is done annually. Coming to colon cancers, in average risk individuals, the candidate will be every person from age more than or equal to 45 years of age up to 75 years of age. The method and frequency are usually different. The commonest method employed is colonoscopy and it is done every 10 years. There are various other methods of screening for colon cancer and they are listed here. In high risk patients, the frequency and method might be slightly different. The screening might start earlier than the average risk patients. So patients who have first degree relative with colorectal cancer or high risk adenomatous polyps, they will be started at age 40 years or 10 years prior to the age of diagnosis in the first degree relative, whichever comes first. Suppose the first degree relative has age of diagnosis 55, then the patient will be started screening at age 40 years. The method will be colonoscopy and it is performed every 5 years for the screening or every 10 years if the first degree relative diagnosed at age 60 years or more. In patients who have diagnosed case of ulcerative colitis, the colonoscopy will be started at age 8 to 10 years after the age of diagnosis and will be done every 1 to 3 years. Similarly, patients with sclerosing cholangitis, the colonoscopy will start will be started at age of diagnosis and will be done every 1 to 2 years. Similarly, patients with Lynch syndrome, the colonoscopy will be started at age 20 to 25 years of age or 2 to 5 years earlier than that of the age of diagnosis of recorded case in the family, and the colonoscopy will be performed every 1 to 2 years. Similarly, in patients with familial adenomatous polyposis, usually these patients are at very high risk of developing colon cancer. Almost 100% of them develop the colon cancer, so the usual screening starts at age 10 years of age and is done annually with colonoscopy. Coming to breast cancer, in average risk individuals, that is every female aged 50 to 74 years of age, the usual screening is done via mammogram every 2 years. But patients with BRCA positive, the usual screening starts at age 25. Those patients who are at age 25 to 29 years, they are screened with annual MRI, and those patients who are more than or equal to 30 years of age, they are screened with annual MRI with mammogram. And patients who are at high risk of developing breast cancer, like those who have family history, the screening starts at age 40 years or 10 years prior to the age of diagnosis in the first degree relative, whichever comes first. Coming to cervical cancer, patients who have normal risk of developing cervical cancer, that is every female of age more than or equal to 21 years of age till 65 years of age, the screening is done via pap smear every 3 years, or other methods are also employed. The methods depend upon the age, so patients at age 21 to 29 years of age will be screened via pap smear every 3 years, And those patients who are 30 to 65 years of age, they will be screened with pap smear every 3 years, or pap plus human papillomavirus co-testing every 5 years, or human papillomavirus testing every 5 years. And in those patients who have increased risk, suppose patients with high-grade squamous intraepithelial lesion or cervical intraepithelial neoplasia grade 3, these patients will even be screening after age 65 years up to 3 consecutive negative pap tests or 2 consecutive negative co-testing. The usual screening plus these screening after age 65 years. And patients with HIV, pap smear is done every year till 3 consecutive negative tests are done, and then regular screening is performed. Usually the screening starts at age of first sexual intercourse or age of diagnosis of HIV. In patients with primary immunodeficiency, the pap smear plus HPV testing is done every year. The screening usually starts at the age of first sexual intercourse, probably. In patients who have undergone hysterectomy due to benign conditions, there is no need of screening. In patients who have undergone hysterectomy due to cervical cancer or other malignant conditions, pap smear is done of the vaginal cuff up to 20 years of hysterectomy, even if 65 years of age is crossed. So this much for today about cancer screening. Thank you very much for your time. We would be happy to get any feedback regarding the content or the quality of videos. We'll be coming up with another video on screening of metabolic conditions. Till then, have a great day.